On September 15th, administration officials, experts, and advocates joined Representatives Barbara Lee, Jim McDermott, and Trent Franks, and other members of Congress to launch the Congressional HIV/AIDS Caucus. The caucus was created to examine methods by which the United States can maintain global leadership in the response to the epidemic. In the 112th Congress, the Congressional HIV/AIDS Caucus will explore 5 thematic areas: implementation of the U.S. National HIV/AIDS Strategy, financing for bilateral and multilateral HIV/AIDS programs, the state of HIV/AIDS research, the role of faith-based organizations, the 2012 International AIDS Conference in Washington, D.C. We had the opportunity to ask Congresswoman Lee the question, what role should the Congressional HIV/AIDS Caucus play in engaging the Congressional Black Caucus and Tri-Caucus for involving communities of color, including Black gay men, in efforts of the caucus? Let's listen to her answer.
You see, I'm the former chair of the Congressional Black Caucus as well as co-chair of the Global HIV and AIDS Task Force. And it was Congresswoman Waters, when she was chair of the Congressional Black Caucus, who led the way to establish the Minority AIDS Initiative. And so what I would say is that more members of Congress now are engaging with members of the Congressional Black Caucus and the Tri-Caucus, because we've been on the forefront of this for many, many years. And so I'm very proud of members of the Congressional Black Caucus and the Tri-Caucus, and now our 59-member bipartisan HIV/AIDS Caucus, because of course it's been African-American members of Congress who have led to this point.
We also asked AIDS United Vice President of Policy and Advocacy and NBGMAC Executive Committee member Ronald Johnson the question, what role should national and grassroots organizations play in holding the Congressional HIV/AIDS Caucus accountable for reducing new HIV/AIDS cases, improving healthcare access and treatment, including new biomedical prevention strategies for Black gay men? Let's listen to Ronald.
The first thing I would say to help us be engaged and to hold the Congressional Caucus accountable is to be engaged with the caucus. We need to make sure they hear directly from us and our members, particularly in terms of the impact of HIV/AIDS on Black, gay, and bisexual men. So often when I'm on the Hill and in offices, we hear staff people say, well, we don't know, we don't hear anything. We need to make sure that they hear from us the problem. We need to be engaged with them with the kind of solutions that are necessary, and we need to monitor their progress. So the key is to be engaged with the caucus, and that also includes making sure that the caucus grows. There are 59 members. There should be every member. There should be a committee of the whole, because HIV is in practically every congressional district in this country, and particularly those districts in which Black communities are most impacted, and Black gay men especially. We need their members to be a part of the caucus, and we need to be working with their members, not only here in Washington, but in the local offices.
NBGMAC would like to hear your voice. Tell us in the comments box what you think about the Congressional HIV/AIDS Caucus and what needs to be done from this body. Also, give your feedback about strategic ways that the Black gay men's community, including organizations that serve them, can hold this caucus accountable for reducing the burden of HIV/AIDS and making sure the populations most at risk are receiving adequate resources to be effective in their work. To learn more or to join the National Black Gay Men's Advocacy Coalition, please visit our website at www.nbgmac.org. Please remember to follow us on Twitter at NBGMAC and also like NBGMAC on Facebook.
With the leadership of the Congressional HIV/AIDS Caucus, we in the U.S. can welcome the worldwide HIV community to Washington next July for the International HIV Conference, with clear evidence of domestic and global achievement toward zero new infections, universal access to care and treatment, and zero discrimination.